my name.
Hello.
Hi.
My name is Ata Gracia. I'm going to be your nurse practitioner today. Today we'll be performing an assessment of the head, face, eyes, ears, nose, throat, and neck, okay?
Sure.
So I have performed hand hygiene prior to coming into the room. And right now I'm gonna ask you to verify your first and last name and date of birth.
Treat shot 11/15/29.
All right, perfect. So that tells us that our patient is alert, oriented, and is in no acute distress. All right, so as I'm moving to the body system, I'm going to explain every step of the way, okay? And if you have any questions, just ask me at the end.
Okay.
Sounds good?
Sure.
All right, so I'm gonna inspect your head, okay? So right now, I'm literally looking at your head shape, making sure that it matches your body, which it does. I'm going to inspect your scalp. I'm looking for any lesion, any masses. I'm going to open the scalp and look for any lice. As I'm palpating your scalp, are you feeling any discomfort, any tenderness?
No.
Okay, perfect. So that tells us that the head is normocephalic and ultramatic. Facial features, as I'm looking at your face, may I touch your face? Facial features are symmetrical. No lesion, masses, or deformities are noted. Prior to while I walk in the room, I already have my gloves. Just keep that in mind. All right, so we're gonna test cranial nerve 5. I'm going to palpate the masseter muscle. You're gonna clench your teeth as I do so. Perfect. All right, so masseter muscles contract equally bilaterally. So that tells us that motor function of cranial nerve 5 is intact. Next, we're gonna move forward to the sensory. So what's gonna happen is that I'm going to touch different parts in your face. We're gonna start with the forehead, move to our cheeks, chin, and nose, and you're gonna let me know if it feels the same on each side, okay? So we're gonna do the forehead. Does this feel the same?
Yes.
We're gonna do the nose. Does this feel the same?
Yes.
The cheeks. Does this feel the same?
Yes.
Chin.
Yes.
Does this feel the same?
Yes.
Perfect. So sensation is intact, and that means that cranial nerve 5 is in fact intact. Next, we're gonna move forward to cranial nerve 7, which is the facial. So we're gonna check for facial symmetry. I'm gonna ask you to do a series of things and just do them, okay?
Okay.
So you're gonna please smile. Perfect. Can you frown for me? Raise your eyebrows. Puff up your cheeks. Pucker your lips. All right, so that tells us that her facial movements are symmetrical bilaterally. That means that cranial nerve 7 is intact. All right, so we're gonna move to the optic nerve, and that's the eyes. We're gonna check for her eye movement. I will be asking my patients to watch me and use my pen light here. And then you're gonna look directly to my nose as I shine the light in your eyes, okay? Perfect. All right, so peripheral. So we checked the pupilla. That's what I was just doing. Pupils are 2 to 3 millimeters, and they are reactive to light. So we also gonna do peripheral vision. You're gonna also look directly at me, and I'm gonna wiggle my fingers, and you're gonna let me know if you can kind of see them, okay?
Yes.
Perfect. Perfect. Look, you have to look at me, okay? Focus on me. All right? Perfect. So that tells us that peripheral vision is also intact. All right, so we're gonna move to cranial nerve 3, 4, and 6. Basically with this one, I'm going to use a H pattern, and then I'm gonna ask the patient to follow my fingers. So I'm gonna basically be using the H pattern as you follow my fingers, okay? So follow my fingers, follow my fingers. All right, perfect. That tells us that EOM is intact and equal bilaterally. There's no nystagmus noted. And so cranial nerve 3, 4, and 6 are intact. We're gonna move forward to our fundoscopic exam, and what that exam essentially does is assessing blood vessels in the eyes. Okay, so what I'm gonna do is I'm gonna place my hands on your shoulder. You're gonna look behind me, okay? And I'm going to, with my otoscope, you're gonna look behind me, and then you're gonna look behind me. I'm gonna place my shoulder in your shoulder, and then I'm gonna also use that same instrument that I was using, which was the ophthalmoscope, and I'm gonna do this. Okay, perfect. So that tells us that optic disc margins are round and sharp bilaterally. There's no AV nickings, exudates, or hemorrhage noted. We're gonna move forward to the ears. I'm going to inspect your ears using my otoscope. Okay, so I'm going to inspect the canal and the tympanic membrane on both ears. So with my otoscope, I'm gonna pull your ear up and back. We're gonna start with the left. I'm gonna pull it up and back and then shine my light. Perfect. I'm gonna do the same thing on your right, up and back, pull the ear up and back, shine my light. Perfect. All right. So it tells us that the external auditory canals are clear bilaterally. It also tells us that her tympanic membranes are pearly gray and intact, and there's no infusion. I'm going to next whisper 3 words on each ear. We're gonna start to the left. What's gonna happen is I'm gonna whisper 3 words. You're gonna have your hands on your right, so you can hear on your right. You're gonna have it on your right. Have your hand on your right, okay? And then I'm gonna whisper 3 words.
Christmas. Daughter. NP.
Perfect. So I'm gonna do the same thing again. You're gonna cover the left. I'm gonna whisper 3 words.
7. Sinus. Eyes.
Perfect. All right. So it tells us that earring is intact. Bilaterally, cranial nerve 8 is intact. We're gonna move to nose and sinuses. I'm going to assess for her nasal turbinate and septum. All right, so with that test, I'm gonna clench your nose up, and then I'm gonna shine the light again with my otoscope. Okay, perfect. Nose is midline without any deformities. Turbinates are pink and moist bilaterally. And we can note that the septum is midline straight without any deviation. All right, so I'm gonna palpate the frontal maxillary sinuses, and you're gonna let me know if you have any tenderness or discomfort. Okay, so I'm palpating the maxillary sinuses, the frontal and the maxillary sinuses. All right, any tenderness?
No.
Okay, perfect. We're gonna move to the mouth and throat. Please open your mouth. I'm gonna assess with my light with the mouth open. Okay, lips are pink and moist. Let me see your teeth. Okay, teeth are intact with no visible decay or cracks. Gums are nice and pink, moist without redness or swelling. Buccal mucosa is pink and moist bilaterally. Hard and soft palates are pink and also moist. Can you please stick your tongue out? Stick it out all the way. All right, tongue is smooth, pink, and midline. Please lift your tongue now. All the way for me. Perfect. Floor of the mouth is pink, moist, without any nodules or drainage. Please say ah.
Ah.
Okay, posterior pharynx is pink, moist, without drainage. Tonsils are 1+ bilaterally, without any erythema or exudates. Okay, we're gonna move to cranial nerve 12. Please move your tongue from side to side. Perfect. Tongue, as we can see, can move freely without any deviation. So that means that cranial nerve 12 is intact. All right. So lastly, we're going to demonstrate palpitation of the left nose. So what I'm going to have you do is please move your neck up and down, side to side. Okay, we're gonna do a range of motion of movement without any discomfort. So I want to make sure that you can move your neck all the way and you're not feeling any discomfort. No discomfort?
No.
Perfect. All right, and I'm gonna look at your trachea. Trachea looks mid-lined. And then now I'm gonna start with the palpation. Okay, so I'm gonna start palpating the preauricular, which is the front of the ear. Okay, I'm gonna move to the postauricular, which is behind the ears here. I'm gonna do the occipital, which is the back of the head, I'm gonna do the tonsillar, which is the edge of the jaw. Okay, I'm gonna do the submandibular, which is under the jaw. Okay. And then I'm gonna do the submental, which is under the chin. Anterior clavicle, which is in front of the neck. Okay. Posterior clavicle, which is the back of the neck. And we're gonna do the supraclavicular, which is above the clavicle, which is right here. Okay, so no enlarged lymph nodes are noted. Lymph nodes are non-tender and they are equal bilaterally. So in conclusion, this completes my assessment of her head, face, eyes, ears, nose, mouth, throat, and neck. Findings are all within normal limits. And as you guys can see, the patient tolerated the examination really well. Miss, do you have any questions for me?
No, I do not.
All right, thank you so much for letting me assess you. You have a good day.
Thank you so much. You as well.
All right, thank you.
Bye.